Tracy. Thank you very much.
Thank you, Jodie. So Esther's going to share our slides, Karen. So
Okay.
and I think I don't think we'll have Ali with us. So as I was saying before, I can cover anything, send children's for the portfolio. There may be questions that I can't answer, in which case I'll take those away. But really nice to see you. I'm Tracy, and I'm Director for Children, Mental Health and Learning Disabilities with NHS Frimley. And I've been with Frimley for just over 5 years, so I know the patch pretty well, and built some really good relationships with colleagues in Bracknell Forest, and work really closely with Grania and colleagues as well, which is great. Karen, do you want to introduce yourself at this point?
Course.
We're going to do a tag team.
Yeah, we'll do a tag team. Hello, I'm Karen Cridland. So I am the Director of Children, Family and All Age Services for Berkshire Healthcare Trust. So we provide the services. We're an integrated trust providing mental health and community health services. So I manage the mental health and community children's services across the 6 local authorities in Berkshire, but work closely with Bracknell, and I have been in Berkshire for just over 8 years. So also know the patch quite well now, and also work closely with Grania.
Great, and important to say that Karen and I work really closally together as well,
yes.
as you can imagine. So good. Okay, so next slide, please. Just really wanted to start by sharing with you our strategic priorities, and you'll probably may be aware, maybe not, but when we started the ICB back in 2022, we developed a strategy specifically for children, and we were very keen to pull all of children's commissioned services into one portfolio. And we worked with our partners across local authorities, across our providers. We worked with children and young people, and we brought all of that together. And we have 5 strategic priorities, and they have really served us well over the past few years. So starting well, transforming neurodiversity services, transforming mental health, supporting children with lifelong health needs, and improving SEND. And actually, when you look at those, actually they're all interconnected, they're all interrelated. And one of the things that we do pride ourselves within Frimley ICB is that, you know, we don't separate off the various parts of the child in terms of commissioning. We bring all of that focus to really make sure we focus on the whole child. And that's really sort of replicated and mirrored, I think, within our provider colleagues as well, where, you know, looking at the child's journey, looking at the whole family, and taking that kind of broader approach. And we also have a number of enablers which we think are really important to help us develop and deliver those priorities. So actually listening to the voice of children and young people in the work that we do is really important to us. The way we use data insights, digital health solutions is really critical, and actually working with, you know, your public health lead, working with Charlotte and colleagues across our data and insights team, you know, we're getting more sophisticated at bringing data together, and that really does help inform decisions we make about, from a commissioning perspective, about where we invest the funds we have for children. We're really committed to a thriving housing and third sector, and personally I have a background in mental health and housing before I came into health, and it's something that's very close to my heart. And, you know, some of the work that we've been doing across the system around damp and mould and asthma, so working with Slough Borough Council, for instance, and our asthma nurse, to really think about how we support children who have asthma in homes that have damp and mould, and making sure that we're working together to sort of escalate those children's and families to get their properties repaired. Our strategic partnerships with education, again, is really fundamental. So the work that we're doing across neurodiversity with our SEND colleagues, education is a really fundamental part of how we work. And of course, quite often it's the schools, it's the teachers who know the child better than the local GP, for instance. So really understanding where the partnership opportunities are with education is really important. And of course, developing our workforce, and some of the work that we've done, which you'll hear about a bit later. So with Karen, so looking at the integrated therapies, for instance, a big part of that work was thinking, well, how do we make best use of the workforce that we've got? How do we, use different workforce modelling to help project where our needs will be in the future. So our workforce is really important. And from a Bracknell Forest perspective, of course, that's really important because, it's about the local economy and the local community as well that we really want to invest in. And then supporting positive transition to adulthood. Really important that, we make sure that those services from 18 to 25s are really strong, that the connections across the system are really strong. And some of the work we've done recently in East Berkshire is developed our needs assessment for people with learning disabilities who are currently inpatient. So those people who have greater support needs, one of the things that we've done is identified where we need to develop housing in the future. And what we've done with that housing needs assessment this time is we've looked at young people from aged 14, because we know that within the next 5 years, some young people who are in residential placements will need housing with support as they grow into adulthood. So really important part of the work that we do, and very much linked to improving SEND, neurodiversity, mental health, and so on. Next slide, please, Esther. So I mentioned user voice and engagement, really important to us. So across all of those pillars of transformation, we work with a whole range of stakeholders. And I think there's a wonderful example of that coming up around the neurodiversity services, for instance, where, we've got parents, carers, we've got amazing groups of people who sort of galvanize themselves into formal networks to help us deliver really good services. We work very closely with Frimley Health, and there's a wonderful children's board in Frimley Health, and they help inform our plans as well. I've mentioned the East Berkshire therapies. So through that journey of work, took into account a lot of service user feedback, and parent carers have really co-produced quite a lot of elements of the performance framework as well. So getting people involved in that sort of co-production space is very important. And of course, the improvement plans, the PAP for SEND, for our local area partnership are very much co-produced with parent carers. And, we work very closely with Bracknell Parent Carer Forums. They sit on our children's board and, very kindly give their time to support us in our work within the NHS. Next slide, please, Esther. So I think it's really helpful to share with you the Neurodiversity Transformation Programme, because this is probably one of our biggest pieces of work at the moment. It's the biggest challenge we have across the system in terms of people waiting a very, very long time for an assessment for ADHD and or autism, adults and children. And actually, if you are somebody who has ADHD or is autistic, or you have a child with ADHD or an autistic child, if you're a carer yourself, you'll know the challenges that we face trying to get the right care and support at the right time. So the real drive for this neurodiversity transformation programme is really about moving from a diagnostic-led service where, quite often you have to have a diagnosis to access services and additional support, to one that's really about focused on need. So doesn't matter about having a diagnosis. This is about really looking at the needs of a child really holistically, and supporting them in a much different way, much earlier on, and really making moving resources really from a sort of clinical medical model into a model that's much more about supporting schools and teachers and parents to understand the needs of children and young people, and provide appropriate support in partnership with organisations like BHFT and our voluntary sector providers. So there are a number of sort of work streams as part of the neurodiversity transformation programme. But one of the important parts of this is to look at the Partnership for Inclusion of Neurodiversity in Schools, and that really is about that sort of education and understanding and knowledge sharing. So huge amount of work happening in that space, and it's a really wonderful example of partnerships between education, parents, carers, and our local authority partners, along with health. We're also looking at an early identification tool. So bit like a sort of assessment tool, if you like, but it's really for schools to use to really help understand people's particular needs. And this piece of work is being carried out across East Berkshire, but we're working in partnership with West Berkshire as well, which I think is really helpful given the moves to the new ICB Thames Valley landscape. And so the early identification tool has a really good amount of parent carer involvement in that as well. And it really does help identify needs and make sure that we're providing the right services early on. Early intervention and early support is really where we need to be, especially with children who are, sort of in a space where they may be moving from primary to secondary school, or those children, young people that have got a lot of change going on for them, that really need that identification and based on their needs, not waiting several years for an assessment. We're working on the adult work stream as well, so that is happening. And what we have identified for adults is actually we've got quite a lot of support in place for children who are waiting to be assessed across Frimley. But actually, we haven't really got as much support in place for adults. So we are working to look at where the gaps are, and we're in the process of doing our commissioning plans at the moment, and so we'll be identifying areas where we need to, shift a bit of money, because there probably won't be any new money, but looking creatively about how we can create a bit of extra funding to make sure that adults get the services they need. And then the other area is right to choose. So right to choose, with many of you will be aware, is the private pathway to an assessment for ADHD or autism. So these are private providers who historically GPs have been able to refer people to, and people then get an assessment a bit quicker quite often than if you were waiting on the NHS wait list, in fact a lot quicker sometimes. Unfortunately, the right to choose market, if you like, has been a real challenge, and the funding for right to choose has really been sort of uncapped activity. And from an NHS perspective, we have not been able to put any restrictions in place for the number of people who go through this private option. We just get sent the invoices and have to pay at the end of the month. this year, we budgeted about £2 million for right to choose assessments across Frimley. After month one, our projected spend for the year 25-26 was £4.7 million. So we knew we had to do something urgently, because obviously that was way over our budget, and for the ICB that would have created some significant challenges. So we went out to our right to choose providers to ask them, what sort of activity do you think you'll be doing over the next year? And they came back with £11 million worth of activity. So fortunately, NHS England have changed their policy and actually enabled us to put some restrictions in place to the numbers of referrals that we would pay for through the NHS. And so we have done that with all of 14 of our biggest private providers. These are called indicative activity plans. So what we say is, we'll only pay for this much. And what we've done is we've looked at last year, we've increased it a little bit and said, that's it, we cannot pay for any more. We're still going to be about 1.7 million overspent, but we think that's a reasonable approach. And there's a huge amount of work that's gone into that. And we have written to all of our MPs, and we've been working with primary care really closely and with our partners. But that's a big piece of work. And alongside that, we are looking at formalising a framework for right to choose providers as well, where we set a price, we look at the quality indicators, make sure that they are providing at the right quality, and working together with Berkshire Healthcare, so with Karen and her colleagues, and West Berkshire, to think about a different approach to the whole process of referring in for ADHD and autism referrals. So that's something that we're working on very actively at the moment with psychiatrist Dr. James Jeffs as well, who's working with Frimley over the next few months to help us with that piece of work. So next slide, and I'll hand over to Karen.
Thank you, Tracy. I obviously work for a provider of NHS services, so I'm going to talk about the work that we do in Berkshire Healthcare with our population. So a slightly less strategic presentation compared with Tracy's, but just to say, as Tracy has kept referring to Berkshire Healthcare, clearly the work that the ICB do, but also Bracknell Forest around co-production or patient engagement if it's a health service, or working with the population of Bracknell, we are also involved in. We may not be leading it, but we are also involved in. So I'm actually going to go through some work that we're doing actually specifically in Berkshire Healthcare. I'm going to start with some of our slightly more strategic work or trust-wide work, and then move down into the work that the services are doing, or some of the services are doing, and perhaps into a very service user focus. So as your interest was around engagement and communication, it was just to highlight that in Berkshire Healthcare we have developed a co-production charter, which I know many local authorities also produce. It's still awaiting publication, so it's still awaiting to go through our governance processes. Otherwise I would have shared it with you today, but we can share it later. We also, in terms of engagement communication, employ staff with lived experience. So we employ staff who are neurodiverse, or staff that have used our mental health services to support our work in developing our services in a more meaningful way. And along with all mental health trusts, we are implementing the NHS England Patient and Carer Race Equality Framework, which is called PCREF. And it's a mandatory framework to support trusts to become actively anti-racist. And the reason for putting this up today is that as a trust, we are responsible for co-producing and implementing concrete actions to reduce racial inequalities within our service. And that's also about access to our services as well. So that's an area of co-production we're undertaking at a trust-wide level. I think it's fair to say that we need to do more development in co-production, hence our charter, because a lot of the work we actually do is around consultation with the people who use our services and getting feedback. So all services in Berkshire Healthcare use a feedback mechanism called I Want Great Care. So it's a patient experience measure, and it's used to gather and respond to patient, or in our case, children, young people, or their parents and carers' feedback. And it enables us to consistently collect and compare anonymous patient experience across all our services. And we use the feedback because it's not just a number, it's actually comments that parents and carers or the young people give us. And it enables us, A, to identify health inequalities, but also to drive improvements in our services. And a bit later in the slide, so I'm going to show you some areas where we've used the feedback in a sort of you said we did way. Our CAM service, so that's our child and adolescent mental health service, as well as using I Want Great Care, also use an experience and service questionnaire, and this is completed at the end of any treatment or intervention. And again, it's about us gathering information to explore how we can improve our services for the people that use them. We review compliments and complaints, and again, we use those to drive improvements. And as well as doing that, we also undertake focus groups. So we undertake focus groups with parents and carers and young people seeking their views on services and communications and leaflets. And we also take part in focus groups that are run by Bracknell Forest as well. In terms of work that we actually do with the parents, carers and young people, we have undertaken some co-production to agree care packages within the service. And we work with schools to agree priorities and service design specifically within the schools. So we try and ensure our services are flexible and it's not a one size fits all across the services. We are developing a new website. So some of you may have accessed the Berkshire Healthcare website, which for the children's area, we initially brought all of children's services together on a website back in 2017. And we undertook some co-production with the parents, our carers and service users. We're updating it. It's a long time in coming. But we are seeking the views of people who use the website as well. And then again, some specific work around that we've worked with children. We do have children and young people as part of our interview panels to ensure that we are having people that come in to work in our services that fit the needs of our service users. I'm really sorry, I've got a little bit of interference going on. I don't know if somebody hasn't got their microphone on mute. I can just hear some noise. Thank you, that's really helpful. Could I have the next slide, please? Okay, I talked about I Want Great Care. So this is a feedback mechanism, but I wanted to demonstrate that we actually use what people tell us to improve the services. So in CAMS, some of the feedback we got was around young people transitioning to adulthood and transitioning into our adult services. And they were seeking access to information about the adult mental health services. And a result of that feedback, we're developing a concise information pack to provide care leavers with the necessary guidance. So this was, sorry, I should have said this was specific around care leavers in response to the feedback. And we're also working with our young care leavers about creating information leaflets. Again, in terms of feedback with our autism assessment, so for our assessments for children and young people aged under 5, our parents and carers were asking our paediatricians for more detailed information and more timely support. And therefore, we've updated our leaflets and websites, but we've also created a specialist nurse practitioner, so a new post to support the parents and carers and young people going through the autism assessment. With our older population, so our 5 to 18-year-olds, we going on from feedback. We've developed welcome letters and signposting so people can get support. And this information is sent immediately after the referral has been accepted with bespoke signposting and clear information and what to expect whilst waiting and how to get in touch. And another area around the autism assessment that we have feedback on was actually how difficult it was for parents and carers or young people whilst they were waiting in our waiting rooms, which I think you can probably imagine are very noisy environments. And up at Upton, where we do see some of the Bracknell population, as a result of feedback, we have developed a very quiet area and with neuroaffirmative visual information boards in the waiting area to make the experience better for our young people. So our CAMS, our CAMS and Getting Help and our mental health services into schools, which we provide in Bracknell. We have feedback from the young people that they get nervous about coming to appointments. So we give as much information and we give our service users, they get a photo of the location they're coming to attend for the assessment or treatment. And that the reasoning behind that is we get help with familiarisation and preparation for clinic appointments. And they also get pictures and pen portraits of the staff so they know who they're coming to see. Sorry, now I'm ready for the next slide. Thank you. Okay, and again, in terms of working specifically with our young people, carers and schools, I've talked about our CAMS Getting Help and mental health teams. So they also have quarterly meetings. I'm using Crownwood Primary School as an example. So they meet quarterly, and these meetings are attended by ourselves, by the school community, by parents, students and senior leadership teams and pastoral staff. And they work together to discuss and shape initiatives within the school community and how the CAMS service in Bracknell can work to support the school. And we also support the young health champions in the school to become secret shoppers for us. So, and the ICB also do this. So we've had young people approach us about appointments, or they've reviewed the website, or they've reviewed our referral forms. We don't know they're the young people. We don't know they're secret shopping. So we actually get really, really good feedback from them about how we can improve things. Our family safeguarding team. So this is a team that supports both the adults and the children. And this team is specifically for Bracknell. They've developed some patient-led activities. So they developed a together group, and they developed co-delivery and a participation space where service users can suggest the activities. And this included planning for the summer areas, the summer of fun activities that they called it. And it's for families open to children, families where their children are open to social care. And some of these families have very limited access to such groups, and some of them have felt stigmatised and marginalised within the universal access groups. And we had a lovely quote from a service user saying that the groups that they helped us design, these were the only groups they felt they could come to without feeling embarrassed about having a social worker. We've run focus groups. I won't go into all of the detail because we can ask questions later, with autism and ADHD focus groups and our children's therapy services. So Tracy spoke about the development of the new service. We send questionnaires and surveys to all the Bracknell Forest schools seeking ideas and feedback on our inquiries line and our advice and support. And 2 of the Bracknell Forest schools have offered to support us in developing our services further. And also the children's therapy services have also worked with parent care forums in mainstream schools. So I think this next slide's my final slide. We go on. And I just wanted to say, so Bracknell Forest Council obviously have a parent carer forum, and we are now working much more closely than we used to in the past with the Parent Carer Forum. We've worked with the Bracknell Forum to give us feedback on shaping our new CAM service and the delivery model. And we are now meeting the parent. So that was specifically around CAMs, but we've now developed a meeting for, in fact, all 6 parent carer forums across the 6 unitary authorities in Berkshire. And we meet with them so they can give us the views from their members directly. And prior to us meeting with them, we gained their views from their members, either via the ICB or often via Bracknell Forest themselves. And working together, we can really build the momentum to strengthen our relationships with the parent carer forums and work together on strategic co-design and co-production. Because I think I said right at the beginning, we recognise that we do a lot of consultation, we do a lot of service feedback, but actually we really, really need to move into the next space of co-production. And I think that's me finished. So it's so thank you for listening, and I think it's time for any questions and discussion.
Thank you very much. That was absolutely fabulous. I do have a couple of questions, but firstly, I wanted to start out with the positives. This is such a good presentation, and there is so much in it that just makes me do a little dance on the spot. I am a mother of 4 neurodivergent children, and I wish I'd had access to this when I was sending them through the CAM system. I will say though that when we were involved in CAMs, everyone was brilliant, and the empathy side of it really makes a difference. So I'm glad that you're using a lot of staff with people with lived experience. So on the feedback, I'm really impressed at how constant and consistently you're doing that, because feedback from patients and staff is so important. It's a way to measure progression. And I like that you're asking proper questions rather than how likely are you to recommend this person to, and using young people, that's fantastic. And using a photo of what the CAMS building looks like, that's brilliant, because I mean, often the parents of these children are neurodiverse themselves and don't realize it. They have exactly the same issues as their children, but they just kind of, I was having a bad day. So having a photo of what the place looks like is a real big deal. I mean, the first time.
Just to say, we've also got a video for it needs updating, and it will be updated for the new website of for a neurodiversity assessment. We've actually got a video to talk people through the assessment and walk them through wherever. So either Poetry House and Slab, but some of our assessments are undertaken on the University of Reading site, so at a place called Early House, to walk people through. So it's not new. It doesn't feel totally new and alien to them when they arrive.
That's fantastic. When my kids were going to the building in Wokingham, the one near the train station.
Oh yes, yeah.
I was so paranoid about turning up late or getting lost that I went there the day before on my own to make sure I knew where it was. So yeah, so this is really good. Cool. So are you able to elaborate a little bit on the scheme that you have going in primary schools? Because I mean, I've been saying this for years, but early intervention is really, really important. So I think that's really good. And will you publish your findings as well, by the way?
So can I just ask, in terms of which scheme? Because we have a lot of services that are doing.
Give me a second. Page number 4. The service provision models. Oh, the partnership with the primary schools for sensitivity tools and training.
Oh, it's the PINS service, Tracy.
PINS,
yes.
Okay.
What was the question about PINS? Sorry, Judy.
Will you publish your findings, and how long will that program continue?
Yes, so we've got, so absolutely, it's part of a national programme of work, and we've got funding for another year, I believe, and then there will be an evaluation of the work. NHS England, whenever they fund these national pieces of work, they're always very keen to do evaluations, which is super helpful. Yeah.
That kind of answers my next question, because these projects, they look really good, and obviously they have a set lifespan. if they're successful and funding is available, is it possible to extend them?
Yeah, absolutely. I mean, from a commissioning perspective, what we, quite often what we'll do is we'll do sort of pilot projects and then look at the evidence, look at, where they can support existing services, and then we can make a really strong business case to release funding to continue to support. But, what I would say is that the neurodiversity work is top priority for our system. It is the one thing that we are all spending a lot of time on at the moment, because we haven't got it right. And if not getting things right, and it not being great for children, for parents, for adults, for professionals who work in the system, as well. It's really frustrating. It's really frustrating for schools. The scale of the challenge is huge, and so the scale of the project that we're doing, the work that we're doing, is really significant. But we're not going to stop until we've really made those changes and we can see people getting much better support, early help, and living their best life. That's what we want. So we won't stop until we see that happen.
Thank you. That's really positive to hear. Right, that's the end of my questions. Councillor Zaharan.
Thank you for putting together this presentation pack. It's very informative. My question is in slide 4. I can see there are quite a few initiatives kicked off in 24, 25, and some planned to in 26. Would you be able to give us some indication of how we are doing with those at the moment, and also any potential risks that you have come across or expected to come across at some point, if that's okay?
Is this for the neurodiversity transformation? Naz, slide 4. Sorry, I haven't got the slides in front of me.
That's the one.
Yeah. Well, yes, there is a risk log, as you can imagine, kind of attached to the work. I think, at the moment, the biggest risk we have is around, making sure. Well, there are individual risks with each of those pieces of work. But the biggest risk is coordinating and making those system-wide changes together. And I think that's always, when you've got a big piece of work like that, that's including parents, carers, children, young people, voluntary sector, schools, local authority partners, community, health, getting everybody on the same page, all heading towards the same end point, really is quite a significant piece of work. I think probably for us, one of the biggest risks at the moment is around the finances, actually, I would say, around right to choose. So that piece of work to put those caps in for the private providers is I think we were bold, actually, because although NHS England enabled us to do that, so made that change gave us a lever, if you like, in the contracting arrangements. Not many ICBs have actually done that. Lots are following suit now, so most ICBs are quite active in that space now, but we started and finished really that piece of work in 7 weeks, because we knew we had to get it done really quickly to get those caps in place on the 1st of September, which is what we've done. So I think that's probably one of the biggest risks. I think the other probably major risk for us is making sure that we are providing support for people while they're waiting. So those people who are waiting for an assessment, those people who are waiting to have a medication review, those people who've had an assessment, who are waiting for medication, it's not, I don't think it's necessarily a patient risk, but it's a risk in terms of we really need to get those people seen as soon as possible. So this is one of the biggest challenges across the neurodiversity pathway. I don't know whether you would agree to that, Karen.
Yeah, definitely. I think we have neurodiversity, we talk about autism and ADHD, and I think in some respects the higher risk is around ADHD when people require medication and they need their medication levels checked, reviewed, etc. So for the patient, that's the bit that carries the higher risk for the patient and for the system.
Yeah.
Thank you.
Thank you, Councillor. Councillor Gore.
Yeah, thank you very much for that presentation. There was a huge amount of information there, huge. I'll have to revisit the slides just to make sure I've got it all in my brain. But I wanted to ask you two questions, really, because I'm not sure I took on board what you said. The first one is to do with the right to choose. Now, my understanding of what you said is that there's going to be a cap on the funding for that programme. Is that right? So how are you going? How is it going to work? Who is going to? Is it first come, first served, or how are you going to decide who gets that, the funding?
The right to choose is the way that people can access a private provider. So actually there's a right to choose, you could go through right to choose for weight loss drugs or other, it's not just ADHD and autism, it's part of NHS public provider initiative, I suppose, back in the day. So for our right to choose, to access to right to choose providers, you have to be referred, Moira, by a GP. So it's your GP that can do a referral. Nobody else can do that. Unlike if you're referred into BHFT, the schools can refer children in now. So, but it has to be by a GP. What we've done is we've spent a lot of time working with our colleagues, clinical colleagues, to set a criteria. And the criteria is like, if you're under 25, just the same. So no change. So no cap, no change. We were really keen that we did not want under 25s to be part of the restricted access, if you like, to right to choose. So we're asking for most of the resource for private providers to go into the children and young people and under 25s. And there is a really clear criteria that we've developed for GPs, and we've done it with GPs, to say, if you have a patient coming to you asking for right to choose, they need to be able to meet this criteria. And that means that there will be fewer people being referred into the private providers, and the private providers will then operate their own wait lists, because they are, they're clinical providers. They know what they're doing. We haven't told them how to operate their wait list or how to prioritize. They will do that. And for general practice, so for primary care, what we've also got is a letter that the doctors can give to a patient who isn't going, who hasn't been able to be referred, so they can see where they can get support from. So it lists all the sort of charities, third sector, our talking therapies helplines and so on. But also if they feel they want to complain about that, which is obviously within their right, then how they do that. And they do that through the ICB. So you don't complain to your GP, because actually GPs haven't made this decision. We've made that as commissioners. So come and complain to us, and we'll answer your concerns. So that's what we've done. So there's a really strict criteria in place. But it's a really good question. I should have mentioned that actually in the presentation, but
it's okay. It's just that I have seen a lot on social media, and everyone seems to head towards right to choose.
They do,
and there seems to be a huge amount. So I just wondered how that was going to be managed. But you've answered the question, so thank you. The other question involves, what you've described as quite ambitious in terms of what you're rolling out. How are you going to ensure consistency at all times in terms of people doing the same thing?
Yeah.
Do you
So
have an audit procedure or
yeah,
some sort of specific detailed training that people have to revisit?
yeah. So is this for the sort of whole neurodiversity and
Yeah.
the looking at the tools? So essentially, there is a working group who are looking at identifying what the early identification tool is going to be. So that will be very similar across. So, in the core areas and functions of that's really important. And so there's almost like a specification that's been agreed across. So whatever tool is being used, it will give us the same, it will demonstrate the same outcomes. And then what we're really keen to do is start collecting better data as well, so that that can inform future arrangements. So things like that tool, things like how we measure some of the work that's being done in schools. So the pins, for instance, that will all be measured and evaluated, and to help us to commission in the future. But the important thing to say is that we do collect quite a lot of data, and actually from a SEND perspective as well, if we think about the work that we've been doing with colleagues in the local authority, we have a whole work stream around data and insights. So a lot of the work that we've been doing and some of the work that we've been talking about, the stuff that we want to change from how we've been doing things before, is really getting that data and insights so it's really clear across the local authority, which really helps us make good commissioning decisions. And one of the things that really tested us, and we didn't do as well as we thought we were going to do actually in the inspection, was how do you use data and analytics to inform your commissioning decisions for children with SEND? And that's an area that we're all working really hard to improve, and we're really lucky to have Charlotte working, obviously, kind of leading some of that work for us in Bracknell Forest, which is fantastic, because she is really good at what she does in public health. But it's layering over the public health data, so your JSNA with the data that we collate, that Karen and her colleagues collate, with the data that we have from connected care, from primary care, and so on. So it's layering all that and looking at the picture of our population and the needs across Bracknell Forest, which is, I think, a really exciting opportunity for us all.
Yes, thank you.
Councillor Penfold.
My question was also about the capping of things. In regard to schools, I was thinking, if you are using a private school, how do you cap what they are charging you, or don't you cap what they are charging, and do you just try not to commission them?
A private school?
Some children have been sent to private schools that are not private in the sense that they have to pay, but they specialise in various neurodivergent needs. We haven't got one within our area, so sometimes they go out of area, and some of them charge a lot of money. Can you cap those, or
well
not?
Just to explain the cap, and we it's not really a cap as such. We're not allowed to use that. So,
Yeah.
Oops,
Okay.
Don't call it a cap. It's an indicative activity plan.
Okay.
Which is a bit like a cap. But basically, what we've done is we've looked at the activity of those providers. So there are 14 providers that do most activity across well, actually, to be honest, it's East and West Berkshire, because many of them work across. So 14 of those main providers. So what we've done is we've looked in detail about all of the work that they're doing, and then we've said we'll pay you for this number of assessments. Now at the moment, Jenny, they all charge different amounts. So that's the other thing. There's a whole range of charges, you know, from £800 right up to £2,000. So one of the things that will really help us moving forward is to have, if you remember, I mentioned the framework. So actually a framework where we set the costs and we say to those private providers, if you'd like to come and work, you know, with you know, kind of with us, supporting our population, this is how much we will pay you. And this is how much activity we will give you. So we're much more in control of telling them what we'll pay and how much we'll do, rather than a tap that's turned on and you can't turn it off. So, you know, those private schools, Jenny, that might provide assessments here and there for children, it may well be that they're charging the earth and they come, but actually to be honest, once we get our framework together, I think that will help some of those smaller providers out there, because GPs won't be referring into those. The GPs will only be referring to people who are on our framework, because they know that the price is reasonable, and more importantly, they know the quality of the service that they're giving to children, young people and adults is a good one. And that's the important thing, because at the moment there's a real variance. You know, some just do online, so you know there is a real variance. So people should be very careful about going to a private provider, because some of them out there aren't great, to be honest.
That's what I'd also heard.
Yeah.
But thank you, that was nice and clear.
Yeah, thank you.
Councillor Brown, last question.
Thank you. Specialist nurse practitioners, how many have you got? You said nurse practitioner.
Yeah, so
position, but
so we have different nurse practitioners for different services, but the one I mentioned, it was a specific new role following feedback that we had got from parents and carers regarding the services we provide with our paediatricians who are based in Slough but provide out to Bracknell. So it's the one I mentioned was a very specific role, and they support some of the autism pathway. So they support the parents going through the autism pathway when they've got children under the age of 5, and the autism pathway is provided by the paediatricians and speech and language therapists. So that role I was talking about, there is only one role. However, we have specialist nurses across all our services. So whether we're talking about health visiting and school nursing. I am
talking about the neurodiverse situation.
So in that particular bit, because it's a support service to the paediatricians, there was one role. Our neurodiversity services that we provide in East Berkshire for the 5 to 18-year-olds, we have specialist nurses working within the rest of the autism pathway, but we have a lot of specialist nurses working in our ADHD pathway.
Okay, so but only one for all the little children.
Well, they don't do the assessments. It's a very different role. So the 0 to 5-year-olds, it's the paediatrician and the speech and language therapist that undertake the assessments. So the nurse practitioner, it is a different role. It's a coordinating role, if you like. So it's quite a different role from our 5 to 18-year-olds, where especially in ADHD, the nurses actually do the assessments but also support the medication.
Oh, yes, that doesn't quite fill the gap I was imagining. Also, do you have input? I know you have input from parents and carers and everybody. Do you have specialist input from people like the Forest Bridge School in Maidenhead, or Child Autism UK, which is actually based in Bracknell, I think.
So when you say input, so as our service, our neurodiversity service is an assessment service. So we provide the specialist assessments from a health perspective. The children who are diagnosed or who are on our waiting list, their support comes from a variety of other services. So it may be the specialist autism services, it may be the specialist schools if they go to those schools, it may be the speech and language therapy, for example, or in East Berkshire, the ICB commission a service called GEMS that can provide the support. So the support for the young people or children that either are diagnosed with autism or ADHD, or they may have it, because there is a difference there. The support services come from a variety of services, and of course Bracknell schools themselves.
Yeah, so you don't include other specialist people around and that are close to Bracknell, but never mind. Thanks.
So can I just add, because I think, so for the neurodiversity transformation programme, there are a huge number of voluntary sector organisations and local organisations involved in that. And in fact, the mapping piece that we're doing is looking at where we have those brilliant small community organisations or slightly bigger third sector organisations that are providing some of those services. So mapping those across and seeing, you know, where that brilliant work is done and where the gaps are. So what do we need more of? So that is all part of the neurodiversity services as programme, Tricia. So really important organisations for us.
Yes, I'm really interested in the specialist information from professionals nearby.
I think that's just about all the time we have. Thank you everyone for questions, and thank you very much, Karen and Tracy, for the presentation. Right, I declare the meeting closed.
Thanks very much.
Thank you very much. Thanks everyone.
Thank you, everybody.
Bye.
Thank you, everyone.